Any severe trauma to the midface can be easily associated with frontal base fracture, and this occurs through the trajectories of the bone between the midface and the skull base. If the fracture involved one or more of the paranasal sinuses, the risk of CSF leak increases. In this example, you see the fracture involving the frontal, the ethmoidal, and sphenoid sinuses. The site of fracture must be localized accurately because this will determine the chosen surgical approach for the repair, especially if CSF leakage is present. The important questions are number, sites, and size of the fracture. For this, we simply classify the fracture into three types. If the frontal sinus is the site, it is type 1. If the ethmoidal sinus is involved, it is type 2. If the sphenoid sinus is involved, it is type 3. Type 2 and type 3 are further subdivided into A and B. The CT scan of thin-sliced bone window in axial and coronal planes can help in detecting some details like thin fracture lines and intracranial air bubbles as signs of injury to the anterior skull base. Sometimes the CT is not enough even with very thin cuts. MRI done in prone position can detect fluid collections in the paranasal sinuses. If the CT and MRI are not successful, then the fluorescein technique is a very sensitive method. 5% of sodium fluorescein is applied through a lumbar spinal tap. The nasal endoscope with blue filtered light source is introduced. In this example, you can see a depressed fracture of the anterior wall of the frontal sinus, i.e. it is type 1. For the first look, you may consider the conservative management for this case. But in fact, it is a surgical case, even with the absence of CSF leakage. Remember that displaced fracture greater than 2 mm have an increased risk of aesthetic deformity and mucocele formation. In this example, you see a fracture in the ethmoidal air cells on the left side, i.e. it is type 2. This type is best managed endoscopically as it is small in size, but large ones are best managed by transcranial approach using fascia lata with or without titanium mesh. In this example, you see a complex frontobasal injury after falling from 2 mm height with multiple fractures of both orbits, frontal sinuses, and frontal convexity of the skull, and it's best managed transcranially. Here you see the scheme of operative strategy with coverage of the anterior skull base with fascia lata shown in red and titanium mesh shown in blue. That processes the uroplasty onto the orbital roofs. And here you see the reconstruction of the anterior skull base and the frontal convexity with titanium mesh. Fracture of the sphenoid sinus is best managed endoscopically, as the transcranial approach risks injury of many neurovascular structures. Thanks for watching.